In this course, the education provision of pneumonia will be delivered in an online provisional PowerPoint presentation, as pneumonia is one of the top 10 leading causes of death in the United States. The thorough understanding and comprehension of the disease is vital in the delivery of care to the client. With the utilization of PowerPoint presentations and distance education, the influence of program delivery on the overall program outcome, the use of technology, and the learning quality that results must be considered in the course faculty evaluation. My target population for this lesson plan is that of the senior nursing students for the University of Texas Medical Branch in Galveston, Texas. Within our institution, the senior level nursing students are the ones that participate in the critical care setting with a higher level of patient acuity. The evaluation of knowledge attained from this presentation will be a graded simulation assessment and patient teaching project provided at the end of the presentation. Each student will be provided the opportunity to interact with the patient in the assessment and teaching process on the disease pneumonia, with a course evaluation provided at the end. The goals of this lecture are to develop a knowledge and understanding of the disease process and development of pneumonia, to recognize the pathophysiological process of pneumonia with a complete understanding of the physiology, and to develop a knowledge of the various interventions and treatments in the care of pneumonia, with the overall goal of this learning activity being that the students comprehend the knowledge provided. The continuous cyclic evaluations are a major component of this success and therefore will be provided at the end of this presentation. The course objectives are to explain the pathophysiology of the disease process of pneumonia while reviewing the anatomy and physiology of the disease process. The students will be able to recognize the various forms of pneumonia with the differential knowledge of the tests utilized to determine the source and nature of the disease, and the students will be able to critically evaluate and intervene as appropriate for the care of the client with pneumonia. The students will also be familiar with the medical interventions and treatments for the disease. Within the healthcare setting, there are many areas of care that are directly affected by the insurance companies and their payment after the care is delivered. With the improvement in care delivery being of the utmost importance within the healthcare setting, the best evidence and practical care is a priority. Adequately comprehending the disease process and its origins will enable the learner to utilize the gained knowledge in the treatment of the patient with the best possible outcomes. The learning outcomes for this course are that the students will be able to compare the treatments and interventions from the various forms of pneumonia and their origin, that the students will be able to explain the treatment measures and the variances for the forms of invading organisms causing the infection, and that the students will be able to analyze the pathological process of the disease with the ability to demonstrate the learned knowledge in a PowerPoint presentation at the end of this course. In this course content development, these outcomes mentioned will be reviewed with recommendations for improvement, possible changes made to the current course structure, as well as the content delivery methods provided to the students. As nursing students must utilize a variety of mental processes, including critical thinking, reasoning, and judgment, along with creativity and solution building, and the application of applying in the healthcare setting, the provision of the crucial knowledge base is imperative in the best capacity. In this presentation, we will discuss the following topics of pneumonia. So what is pneumonia? Pneumonia is an infection that affects the lower respiratory tract caused by various invading organisms such as bacteria, fungi, protozoa, and viruses. There are two different types of pneumonia, including viral and bacterial. There are additional categorizations of pneumonia based on how and where it is acquired, including community acquired, healthcare associated, also described as hospital acquired, and ventilator associated pneumonia. Those most directly affected by pneumonia are those who are elderly, alcoholics, those who smoke, and those who may have nutritional deficits. Those affected by pneumonia will usually present with an overall appearance of fever and malaise, with a productive cough and respiratory distress. Pleuritic chest pain may also be a complaint and will need to be investigated further in the assessment differential of cardiac concerns versus pneumonia. Upon a physical examination of the client, fine or coarse crackles may be heard upon inspiration. There may be tactile fremitus with the palpable chest vibrations, or a gophony with the ah sound over the consolidated lung tissue while the patient is saying E. Pneumonia is a complication of the upper respiratory tract in which the virus then spread to the lower respiratory tract, destroying the ciliated epithelial cells in the process. This then leads to the invasion of the goblet cells and the bronchial mucus glands. The sloughing in the destroyed bronchial epithelium impairs the mucus clearance by the cilia. Influenza viruses impair antibacterial defense mechanisms by increasing neutrophil apoptosis and neutrophil and monocyte dysfunction, depressing chemotaxis and suppressing phagocytosis. The virus not only destroys the ciliated epithelial cells, but also invades the goblet cells and bronchomucous glands. As the bacteria multiply and the inflammatory process progresses, pus accumulates, resulting in a process of consolidation in which the alveoli become filled with pus, further inhibiting the respiratory process. The body's defense mechanisms, in addition to the inflammation process, is the natural coughing to expel that pus. Pathology. Once a microorganism overcomes the upper respiratory defense mechanism, such as a cough, the next line of defense is the epithelial cells of the airway. The most important cell to remember is the alveolar macrophage. It recognizes the pathogens through its pattern recognition receptors, activates T cells and B cells with the induction of cellular and humoral immunity, and the release of TNF-A and interleukin-1 from the macrophages and chemokines. This results in the inflammation in the lung with the recruitment of neutrophils from the capillaries for the lungs into the alveoli. Pneumonia is an acute inflammation of the lung parenchyma caused by an infectious agent that can lead to alveolar consolidation, as stated by Juarez in 2015. Diagnosis of pneumonia can be completed with a chest x-ray, sputum culture with gram stain, don't forget that, blood cultures, and white blood cell count. It may be high, but it may also be low in immunocompromised or the elderly, and ABGs, including hypoxemia signs. Once the diagnosis is made of pneumonia, the identification of the pathogen is done by means of sputum characteristics such as the gram stain, color, and odor. Stains and cultures of blood and respiratory tract secretions are completed in more severe and hospital cases and before the initiation of any antibiotics. Additionally, the C-reactive protein levels can be utilized in the differentiation of bacterial and viral infections in order to guide the appropriate therapy. Additionally, electrocardiograms or ventilation perfusion exams can be performed in the differential diagnosis between heart failure and pneumonia. Prevention measures include the prevention of aspiration, respiratory isolation of those who are immunocompromised individuals, and vaccinations for those who are 65 years or older. Additional prevention measures can be done with a variety of methods, including that of adequate oral hygiene and other endotracheal interventions for those patients who are already intubated. The first step in the management of pneumonia is establishing adequate ventilation and oxygenation. Adequate hydration as well as good pulmonary hygiene, like deep breathing exercises and coughing, as well as chest physical therapy, are also equally important. Antibiotics ideally are initiated within 4 hours of presentation of bacterial pneumonia. Empirical antibiotics such as Zosyn or ampicillin are used in the treatment of ventilatory acquired pneumonia. According to the 2014 National Institute for Health and Care Excellence, the recommendation is to only give antibiotics when the C-reactive protein levels are greater than 20 millimoles per liter, and that there are positive clinical findings. Hypercapnia is the increased carbon dioxide concentration of the arterial blood and is caused by hypoventilation of the alveoli. With hypoxemia being caused by respiratory alterations, this will result in reduced oxygenation of cells and tissues and can lead to cellular death. In the acute respiratory failure, there is an inadequate gas exchange and can result from direct injury to the lungs, airways, or chest wall, or can occur indirectly as a result of the disease or involving injury to another body system. With the presence of a pleural effusion and empyema that often result as a complication of pneumonia, additional therapies such as antimicrobials and chest tube therapy may also be needed, extending the length of the hospital stay for the client while also increasing the patient mortality rate. Questions. What interventions can be implemented for improved oxygenation in the client with pneumonia, and how might you explain these measures? What are the priority treatments of the client with presenting symptoms of pneumonia? And based on the information that I have provided, what is the exact process occurring in the body's defense system? In conclusion, the diagnosis is based on a full evaluation of the client history, physical examination, white blood cell count, procalcitonin or C-reactive protein level, and chest x-ray. Once the diagnosis has been made of pneumonia, the pathogen can be then identified by a sputum sample for appropriate medical management. How and what the invading organisms are and what they will do will directly affect the implementation and therefore the treatment process. What we do as healthcare professionals in the immediate recognition of the process and the prompt interventions will directly affect the process recovery of the client.